So with all that in mind, we developed a toolkit to help guide our primary care and specialty practices about solutions that they could take charge of and implement to try to provide more appropriate continuity of care for patients that they serve. This was formed by a group of people across our MidSouth Practice Transformation Network with a variety of backgrounds, including medicine, health coaching, administrative leadership, and included physicians from the hospital and emergency room, as well as individuals working in safety net clinics and in private settings. We decided to organize our toolkit in 5 key areas. One is about improving access. Another is improving triage services. Third is education. The fourth is collaborating with local institutions. And the fifth has to do with post-ER follow-up to care for patients' ongoing needs and learn what drove them to the ER to begin with. So I'm going to give an overview of what's in each section, and then I'll present just an example of the more detailed content. This is not the full toolkit which I'll be going through, but it'll give you a flavor for the kinds of approaches that we are trying to implement across our broad network. In our toolkit section on improving access to care, there are 5 elements. One is we provide example surveys that clinics can adapt and use to ask their patients about how easy it is to get access to the services that they need in the clinic. There are also some approaches to assessing time slot utilization, because not every clinic can just add more time to the day. Sometimes it comes down to more efficiently using the time that's available. We also have some tools to help clinics align the appointment length with the need that the patient's coming in for, rather than just using fixed blocks of time for every kind of appointment. There are some protocols for working with urgent issues. For example, telephone triage scripts for common complaints like urinary tract infection. And we also have some information about trying to create some same-day or next-day appointment availability and how to maximize the value of that. This is an example of one of the specific tools in this section, which is the patient survey on clinic access. So I won't go through this fully, but we provide this as a survey that practices can modify and administer to their patients, perhaps in the waiting room. They might choose to administer this for a week or so to get a better feel for how easily patients can make a same-day appointment in their practice, how well they are able to get in touch with somebody after hours, and really identify the practice performance in this access area. The next section of the toolkit has to do with triage. There are a lot of systems in place at a practice which may or may not be deliberate to handle patient phone calls and visit requests. And in this section of the toolkit, we encourage practices to really look under the hood and see what protocols they have in place for managing same-day appointment requests, what nurse triage protocols are in place, what does their after-hours messaging look like? So when patients call the phone number for the practice, what does the message say? Have they really considered an after-hour call service or nurse advice line? And what are some techniques they can use to have somebody on call for urgent patient needs? So we provide examples of after-hours messages that practices could consider using as their voicemail system. What you all may recall is if you call a medical office, commonly the very first thing you're told is if this is an emergency, hang up and dial 911. Well, that is not the behavior that we should really be encouraging. That may be important from a safety perspective, but can we just put that at the end of the message and instead begin the message with explaining how patients can access the practice, how to reach somebody who's on call, provide some information about what to do if they have a less urgent need, and what are the office hours, and then direct them if needed to the emergency room. The third section of the toolkit is dedicated to patient and family education. It provides practices with some suggestions about how to share their office hours, services, website information, and we have some posters which educate patients on where to seek care for routine or emergent issues. And then we work with practices on how they can distribute these educational materials, both in their waiting rooms and through other ways of reaching out to their patients. There are actually a lot of ways to inform patients about after-hours access. For example, the practice may have letters that go out for other purposes, and they can add a footer to their letter with some practice hour information. They might choose to give their patients a refrigerator magnet so they can have a phone number to call with the hours of the practice, and most importantly, a phone number to call for any after-hours issues that they may be experiencing. This is an example of the type of poster which we've been distributing to our practices. We developed this from existing tools that we gathered from other medical centers, embedded it with both adult and pediatric physicians. We have two versions of this. We are happy for practices to modify this to meet their needs. And the emphasis here is on providing some guidance to patients about when they should go to their regular clinic, whether it be primary or specialty care, when to go to an urgent care center, and really what things they should go to an emergency room for. This is the pediatric version, set up in the same way, but focused on different content. The fourth section of our toolkit is about local collaboration. And the reason we put this in our toolkit is we actually heard stories from practices that are in our network where instead of expanding their own hours into the evening and weekends, they've effectively partnered with urgent care clinics in the area. So for example, the practice develops a relationship with one or two nearby urgent care centers. They commit to providing the urgent care centers with information about the patients in a timely way if patients are seeking care in urgent care. And the urgent care clinic in turn agrees to provide the practice with timely information about what care was provided, what medication changes were made and why, and what follow-up is needed. And they actually work together to review episodes of care for quality as part of the ongoing collaboration. We've got some other practices that are working with emergency rooms to build relationships and improve the continuity and opportunities for education. These are just some examples of what I was mentioning earlier with urgent care. It's really about a two-way relationship and important to build it with both the clinicians and the administrators. There are a lot of information needs as patients are getting care in different sites. And one of the things that a partnership could discuss is whether they're going to exchange patient information on a daily basis, weekly or monthly, and what that's going to look like. Is it just going to be a list of patients who received care in the urgent care setting, or is it going to provide more detailed information? And there are a lot of opportunities around quality which can emerge from a deeper collaboration over time. The last section of our toolkit is about following up with patients after they've been to an emergency room. What a great opportunity to understand why the patient chose to go there. What questions do they have after their visit? What follow-up is needed? Maybe there's an opportunity to provide education on what are alternative places that the patient could have gotten care if it was a low acuity issue, and to understand the barriers to receiving care in the clinic. We may find from talking to patients that they're actually told to go to the emergency room by the clinic, maybe because of who picked up the phone or what time of day it was when they called. And those are good opportunities for practices to really understand from their patient base, some additional insight into practice improvement opportunities. So again, in this section, we provide some sample surveys and sets of questions that practices can use when they're interacting with patients after an ER visit. We do encourage our practices to call patients if they've learned that the patient has recently been to the emergency room to see what was the reason for their visit, what medication changes were made, did they fill the prescription that they were given in the emergency room, what are some follow-up appointment needs, etc. I'm going to end with this slide. There's a lot of stuff in this toolkit, and practices are all at a different starting point. So one thing we've tried to do is provide some organization for practices that are just trying to get started in reducing ER visits. We point them to sections of the toolkit and to some good starting points. For example, surveying patients about their ease of access to the clinic or updating their after-hours messaging. Some practices are farther along and are ready for more intermediate difficulty approaches, like engaging in after-hours call service or expanding their own time slots. And some practices are really working on more advanced topics, like partnering with those local urgent care centers or ERs.